How to write your case report. If you go to, this is a case report that I've written recently about treating COVID-induced post-immune ANCA-negative presenting glomerulonephritis. So your case report, you have their authors, their affiliations. You have to choose the corresponding author, and then the author's email addresses or their ORCID ID, which is like researcher ID. You can Google that. And then you have summary or abstract of your paper, just like 300 to 500 words, not more than that. Those keywords for indexing the article. And then you have fixed topics, titles, background, case presentation, and then you have figures if you have any, tables, and then you have also discussion. Discussion can be just a few paragraphs, or you can give it some titles if it needs to. And then there is conclusion. And then at the end, there is references. Usually the references are not more than 20. Okay. So this is an example of a case report. And this is a template that I can share with you after this presentation. You have your title page, which you have the title, the number of authors, usually 3 to 5, like we said, with their affiliations, emails, email addresses, and ORCID. Corresponding author, it has to be listed as well. And then only 4 parts: background or introduction, case presentation, discussion, conclusion. This is just the summary. Do it at the end. And it's very important if you're going to submit for a conference, because when you're submitting for a journal, it asks you for the whole manuscript. But if you're submitting for a conference, for a poster or a presentation, it only asks you for a summary of this. So just do it at the end, but it will be, abstract will be the form that we submit to conferences, but the whole manuscript will be the form you will submit to journals. And then this is how you should write it, actually. You have your title here, and then everything you write, it has to have a reference. We cannot just write, even if it's something very common knowledge, it has to be with reference. And I will tell you now how to do it. So for background, you write maybe one paragraph of, let's say we're talking about Moya and Graves' disease, for example. So you write about the incidence and prevalence of Moya and Graves. If you find any cases in literature, you should mention we found like similar cases, or we didn't find any cases that's like this case. That's why it's interesting. And then you summarize your case just in 1 to 2 statements, and then 1 to 2 statements why this case is challenging or atypical, and then summarize your key lesson or success in managing this difficult case, or whatever unique or rare about your case. So you will only have to provide reference for the incidence, prevalence, and maybe similar cases if there's any. The rest doesn't need references, just what you found in your case, right? And then, okay. And then the case presentation itself doesn't need any references, because this is your case. This is a summary of what you've seen. Just one statement about demographic, like this patient is 45-year-old man or something like that, and then presenting complaint, one statement is presenting with just like one complaint, like hematuria or chest pain or whatever. One statement about positive history, like this patient has a past medical history of ischemic heart disease or something related that's very important. And any negative relevant history, sorry, the positive history means like the positive symptoms that he has, like he has shortness of breath or hematuria, any symptoms that he has that's related to the main complaint or the disease. Negative history is the negative symptoms that are not there, that are important to know about this patient. And then past medical history, you write the positive and the negative. Positive means what medical comorbidities we should know about in this particular case that the patient has. Negative means what does the patient doesn't have that help us rule out some other differential. You don't have to mention the whole medication list, just one statement about the important ones, okay? And then allergies, surgery, family history, mention only if they're relevant. Otherwise, say negative or unremarkable, just one statement. And then that's your history part. It's usually in one paragraph with no uh, references at all. And then you go for your physical examination or vital signs. You start with vital signs, just one statement: the temperature was this, and blood pressure, heart rate, saturation, just to give the reader an idea of how the patient did look like. And then you mention the physical exam, just one statement for the positive findings. Let's say this patient had rash or splenomegaly or hepatomegaly or whatever, and negative physical finding that the patient did not have, like he didn't have crackles, he didn't have edema, something that's related to the case. You don't have to mention the whole exam, just one statement: positive findings, negative, one statement of negative findings. So that will be your physical exam. It can be done in one paragraph as well. And then you go for the third paragraph, which is lab investigations. Usually we do it in a table format, the test in one column, and then the lab value of the patient, and then reference value, just because it will differ if you're writing it in the UK or the US. Both have different reference values. So you write all that according to what patient had. And then you can do another table for imaging studies if there is any. So those are the two tables we usually add. And then you can also add some figures about is there any X-ray, CT, MRI, biopsy, histology, anything like that. So usually if two tables, two, three figures, that's what you need. So you have to, if you included that table, you don't have to mention all the investigations again in your paragraph. Just mention the summary of the positive lab findings: high, normal, low. Okay. Mention your imaging studies again in a table. So that will be your case presentation: history, and then vital signs examination, summary of lab and radiology or figures if there's any biopsy or histology. And of course, if you have more figures, that will look better for your case report because publishers want to have figures and images. And then last paragraph in your case presentation part is you summarize your clinical thinking and management. So you can say, we found this patient has this differential diagnosis, and then we've treated the patient in this way, and then this happened, and then this happened, just in one paragraph. No literature, don't include any references, just focus on the facts, include figures like we said, ECG as well, one big one. So this case presentation is the core of your case report, and it should reflect what you think as a clinician and how you approach the patient and how you manage. And if I read this, I should know where you're heading towards your discussion later on. And then the next step will be discussion. Usually you have a lot of references here because everything you will say, basically, it depends on literature, on your search in PubMed, for example. But only include relevant information. You don't have to let's say you're talking about Moya disease and its association with Graves. Uh, this is not a review. We're not going to discuss everything related to Moya or Graves. No, we're not doing this. Basically, you will do one statement of definition of the disease and condition. Let's say Graves is this and this and this, and Moya is this and this and this. And then any diagnostic criteria that applies to your patient, if there is any, just one statement. And then one to two statements about the cause of the disease or the condition, what causes Moya, what causes Graves, and how they might be related, and the pathophysiology, if there is any. This all from the literature. You don't have to mention it. I mean, you're not going to make it up. You have to get reference for everything. And then how it's being treated. So basically, you're doing one paragraph about summarizing the Moya and Graves disease from the literature: definition, diagnostic criteria, etiology, pathophysiology, treatment. And then one paragraph of discussing what is related to your case from the literature that make it interesting. A typical diagnosis, or it's rare, or some imaging finding you found, or a key lesson that you would like to convey to your readers. It has to be from literature, saying, oh, when I looked for the literature, I didn't find any Moya and Graves disease happening in pediatric patients. And my case is a pediatric patient, for example. or this one usually it's treated by this treatment by tried that treatment and it worked or didn't work or something, right? So that's another paragraph. And then one paragraph summarizing the case again that you discussed before, just one paragraph, and linking the literature to it and why it's interesting. And then maybe if you found similar cases, you can write 1 to 2 paragraphs about that and just compare and contrast. Like, oh, we found similar cases that this and this, we did the same and it didn't work or worked, or this is different from our case, this is similar to our case. Just 3 4 lines, not more than this. So this is your discussion template, and then your conclusion is summary of the paper in just 1 paragraph. Why it's important, the key lesson, no references here. So as you've seen, um, the background, just one big paragraph, a little bit of references, case presentation, 3 or 4 paragraphs, no references at all. Discussion, 3 4 paragraphs, some references. Conclusion, 1 paragraph, no references, and then you write your keywords. So that's what it usually is. And then you should put your references according to journal style. Usually 20 references, not more than this. Some journals will not accept your paper if it has more than 20 references or more than 5 authors. Those are your limits, kind of. So that is how we format our case report. But I just wanted to show you as well how to write and do references in the same time. So if we go to here, so let's say I went to Google now and I would like to know the pathophysiology of Moya disease because I want to write it and document it. So I can write Moya pathophysiology, let's say, and just write PubMed next to it. Okay. And then it tells you here there's an article that's progressive stenosis of the large intercranial arteries, something, right? So you go to that paper and you can read it, read even the abstract. If you find what you're looking for about the pathophysiology and the causes, then summarize it and paraphrase it in your own words after you understand it. You cannot just copy and paste, that's plagiarism. And you can read, understand, paraphrase in your own point, and then click cite, take that reference, and then put it in your Word template. Just a second here. So you put that reference here, and then let's say I'm talking about pathophysiology of Moya, and then say it includes something, and then write 1 because this is my first reference, and then I have the reference here already. And then let's say I would like to talk about the causes. Just 1 statement. I go to PubMed, search for causes, and summarize it in my own way as well. And it will be number 2, and then put it again 2, and then put the reference. This is how it looks like. I'm not gonna do it all, of course, because of the time, but it shouldn't be more than that. And 20 reference, you're done. So case report, honestly, if you have like a free weekend, you can finish in 1 day. If 2, 3, 4, 5 are working together, maybe a week you can finish it. It's not difficult to do.